Liver transplantation is basically required for people who have got liver disease which has progressed to such an extent where there is no cure left with medicines. Once you have liver cirrhosis progresses by stages. When it's at the early stage, the cirrhosis can be managed with medicines, the complications of cirrhosis can be managed with medicines. However, after liver cirrhosis or liver disease reaches a certain stage where there is no longer a role of medical treatment in that, that is a time where we advise that the patient should have a liver transplantation. So not just liver cirrhosis, there are a lot of patients with liver cancer, or there are children with congenital liver problems. Then there are also patients with acute liver failure where the liver just overnight stops working. These patients are also considered to be candidates for liver transplantation. So once we've decided that a patient needs a liver transplantation, now how do we, the patients come to us and ask, doctor, what next? What do we do next? So we tell our patients that the step from the decision to transplantation to the point where you have a transplantation is a step-by-step process. It does not happen overnight, that we tell you that today you need a transplant, tomorrow you have a transplant. The first step is that the patient has to be evaluated whether this patient is fit for a transplant surgery or not. What happens is in liver disease is that liver disease, when it progresses, it becomes a multisystemic involvement. So by evaluation, what we need to see is are the other organs of this person, of this patient, in place to tolerate such an extensive surgery. By other organs